Hey guys, I'm super excited to be with you today. Why? We have this new exciting procedure to help you with enhancement down below. What are we talking about? We're talking about penile fillers. Dermal fillers is a non-surgical procedure that I recently introduced to skin aesthetics, and the results have been absolutely amazing. This procedure will allow you to increase the girth and width of the penis anywhere from 20 to 50%. Research and clinical studies have shown the girth of the penis is the primary factor that affects the sensitivity and satisfaction in both partners. My patients have repeatedly told me time and time again that both themselves and their partners, they do experience increased and heightened sensitivity and satisfaction during their intimate encounters. It is done with hyaluronic based fillers that are totally reversible, makes this procedure temporary. While it is long lasting, it is still temporary. So if for whatever reason you do not like it or you don't think that it suits you, you can be rest assured that over time the enhancement will dissipate. While penile fillers, of all the things, penile augmentation is a relatively complicated process, and before the advent of dermal fillers, the only options would involve a surgery. So the results associated with surgical procedures are sometimes not the best, plus all the risks and side effects that inherently are going into any surgical procedure. Well, let's talk about the results. So the results are absolutely immediate. Minus some swelling and bruising, you will be able to see the results right away. Hyaluronic acid fillers function is when they are injected under the skin, they immediately expand and produce that volume that we're looking to get. You should expect for the results to last anywhere from 1 to 2 years. All right, so let's talk about safety now. Obviously, anything that involves a sensitive organ such as penis, the safety has to be a top priority, no matter what. We are using dermal hyaluronic-based fillers that can be both reversed if necessary, and they also degrade over time on their own. Totally biologically compatible with our own tissues because hyaluronic acid is present in our bodies. So that is not a foreign tissue or foreign compound that the body can reject as long as it's done by a medical professional who understands all the anatomical aspects of the procedure. You're totally safe. All right, guys, let's look at the penis in cross section. So we have the glands of the penis or the head of the penis. We have the shaft, and then we have all the layers that make up the penis. We are targeting our injections between the skin and the facial layers. Those are very, very targeted injections. So you must absolutely know what is happening, how to inject, how to avoid complications, how to make sure that the results are fantastic. I can inject both the glands and the shaft. Some doctors only inject the shaft. I inject both. So why is this procedure so revolutionary? Think about it. Literally a few injections, with a few targeted injections, we can increase the girth or width of the penis anywhere from 20 to 50%. Because of the weight of the filler that is placed into the penis, it allows you also to increase your flaccid length. That is something that most other procedures cannot accomplish. So one more time, not only you get increase in girth, which is super important, but also there's an increase in flaccid length. Patients who choose to get their head of the penis, also known as glands of penis, injected, they do get a little bit of erectile length increase. All right, guys, so let's talk about aftercare and downtime. Contrary to what you may think, there is minimal downtime and minimal aftercare. And when I say minimal, it is really minimal. The main two restrictions that you must follow and that you must adhere to is staying away from sexual activity and heavy exercise for 7 days. That is it. Think about it. 2 things, 7 days. The rest of your day-to-day daily routine is totally unaffected. You should only stay away from sexual activity for 7 days and no strenuous exercise. 7 days. Besides that, you're totally good to go. Most of you most likely think that this is an extremely painful procedure. Well, guess what? It is actually not. Contrary again to popular beliefs, this procedure involves minimal to virtually no pain. Why? Because the skin is numbed with a very strong topical anesthetic, and that is then followed by a local lidocaine injection, which totally eliminates all the pain. So what you guys will feel during the procedure is minimal pressure, and that is it. So minimal pressure, no pain, no discomfort, no nothing. 30 to 40 minutes, you're done and you're good to go.